My name is Carolyn Flowers and I'm from the Islands of Roatán, Honduras. Before, in all my life, I did not trouble with headaches.
My mom started with a crucial headache. It was going on for like a week with no ease at all. We were administering painkillers and she was getting no help with the symptoms. A few days after, she started vomiting and the headache got a lot stronger. I took her to a hospital, I admitted her. That's when we got evaluated by a neurologist there in Roatán, and he ordered a CT scan. With the CT scan, then we got to find out that she had a tumor on her cerebellum.
The tumor on the scan initially looked a little suspicious, maybe benign, could be malignant. And to add to it, it was in a very delicate area of the brain, what we call the CP angle. It's the cerebellopontine angle. Now, this is a very delicate zone where a lot of nerves that control our swallowing, facial expression, balance, all of these come in that region, and this tumor was pressing on all of those structures. This is a tumor called a meningioma. It's a common benign tumor that could happen to people in the brain. In a way, it's not harmful, as in it does not spread to other places, does not spread to other areas, but the complexity depends on the location. And these tumors are very, very slow growing. So a lot of time people do not know they have these tumors until it grows to a certain size where it's pressing important structures and causing symptoms. There were going to be big challenges in the surgery considering the location and the size of the tumor, but having the infrastructure that we have around here, we were confident that we could do this surgery pretty safely for her. The good part was that it did look benign at surgery and we were able to take it out completely.
We just decided, well, if we're gonna do it, let's just go to a hospital that we know that has the specialists and has the technology and has everything that can save the life of my mother.
Along with the skill, there is also the modern technology that helps us in. We have intraoperative nerve monitoring where you can connect these electrodes and monitor function of the nerves. So you know you can stay off important nerves, you know you're not stretching or damaging them during taking it out.
After receiving the results that Dr. Shushil gave me, it was, I don't know what more to say, no more than thank you, Jesus.
Sometimes it's very important for patient care, the way you treat the patient, right? If you don't treat the patient in the proper way, the patient doesn't have that trust in you. So for me, as being a doctor, that's the most important thing in patient care. It's amazing the service that they offer here at Health City. From the moment you walked in, everyone is so nice to you, and the service that the doctors give you is just excellent.
She's doing great. Like immediately after the operation, maybe in a couple of days, her balance significantly improved. She no more had the headaches that she was having before. Operative site healed very beautifully. And she went home in maybe a little sooner than we expected even.
I haven't had no more pain, not even after I came up. No more pain, thanks to Health City and to Dr. Shushil, for Dr. Marjorie, for advising my daughter on what she could have done here.
I want to thank God firstly, because without him this would not have been possible. But I want to thank also friends, family, all of the churches, and the whole community of Roatán. Because if it was not for them, this would not be possible today.
I feel so good. I'm ready to see my family and friends back home also.
I did see her at 6 months back in a clinic in Roatán where she's doing extremely well. She's able to do all that she wants to do. She even had a repeat MRI scan at 6 months that shows no growth and complete excision. So she's doing great.